Live from Capitol Hill on gloomy Wednesday, the 1st of April, the year of our Lord 2020, as America finishes one of the toughest months in its history and is about to go into the whirlwind of an incredibly tough month, probably as tough in April as we've seen maybe since, 1775. Very, very tough days ahead of us, and we know this from the White House briefing yesterday. Welcome to the show, John Fredericks Radio Network, America's Voice.News, the streaming platform of the Trump movement, now Dish 219. Newsmax TV, also ubiquitous throughout the world on every platform you can get to, up on YouTube or on Facebook, full access, hundreds of thousands, not millions of viewers every day, and on podcasts.
By the way, you know what I realized? I've been using this Pluto app to watch television for months, and America's Voice is now on that, and it's fantastic.
Well, how do people? So the Pluto app, we're everywhere.
Yes,
ubiquitous. Plus on podcasts, almost 5 million downloads. Want to thank you for the support. Here we separate out the signal from the noise. Very grim, over 2-hour press conference yesterday. If you had listened to the show in the morning, you would have basically known what was going to be said. We got so much to go through the day, and we're going to start grinding through it. Let's start with some clips from yesterday, and that will tee up how we want to get to this. We want to have we're going to have a partners discussion. How does that sound? We're going to have a partners discussion, in that we're going to go through and deconstruct what happened yesterday, what's the background for it, what it means. Remember, here it's the pandemic, it's the economic crisis, the financial crisis, the geopolitical crisis. It's the political context. Politics is not a crisis now, but the others are. And you've got to, in getting and understanding this, you've got to get to the pandemic part and understand that. That's the key that picks the lock. Everything else comes off that. The economic crisis comes off that, the financial crisis, the geopolitics, but you got to understand the pandemic. So let's get to yesterday, and we'll start talking about the numbers, talk about the math, and we'll talk about the intellectual construct that they're using to kind of get to these, where this thing is headed, and then what actions are taken. Remember, we talked yesterday, it was analytics first and then the execution of the plan. So let's go to the analytics.
And this is Jim Acosta from CNN asking a question of Dr. Fauci.
Deaths always lag. So you will be seeing deaths at a time when, as an epidemic, we're doing really, really well, because the deaths will lag.
Dr. Fauci, should Americans be prepared for the likelihood that there will be 100,000 Americans who die from this virus?
The answer is yes. We need, as sobering a number as that is, we should be prepared for it. Is it going to be that much? I hope not. And I think the more we push on the mitigation, the less likelihood it would be that number. But as being realistic, we need to prepare ourselves that is a possibility, that's what we will see.
A very short period of time for that to happen.
Right.
Can the country handle that in such a short period of time, within a couple of months?
Yeah.
50,000 a month.
It will be difficult. I mean, no one is denying the fact that we are going through a very, very difficult time right now. I mean, we're seeing what's happening in New York. That is really, really tough. And if you extrapolate that to the nation, that will be really tough. But that's what it is.
So, Steve, that was, look, there were a number of things about this press conference that I have an issue with, or I think that we need to pay attention to. I mean, this really is the press conference that changed everything. I think the optics of it, I think we're off to have the president standing up there in front of a sign that says, between 100,000 and 240,000. I think that's a briefing that you have your scientists, your CDC, your Birx, and your Fauci, those types deliver it to it. But it's also, there are some ramifications from the press conference. The media is now going to, as you see from today's headlines, every single headline is either at least 100,000 dead, or Trump says as many as 240,000 dead.
Okay, here's what I'm going to do, because the media they're just a bunch of actors. I mean, you have some specials up there that are pretty good, but they're basically actors. So we're going to think this through as we've thought it through from the very beginning. Here's one of my concerns. I want to go to the clip, to the cut, where Birx says full mitigation. Here's what I want you to do. Full mitigation. And I want, then if we can go to the thing from yesterday of Dr. Murray from the University of Washington, we still have that talks about the buried lead you found about the no-made. Do we have the Birx? Well, she's up there and she says this is about full mitigation?
Not teed up. We're getting that right now.
Okay, fine. So here's a couple things. Number one. I don't think it's look, and this is all take this in the form of constructive criticism. Okay, we're all on the same team, and that team is the United States of America and the world. I don't know if it's helpful to have up there and to outsource the math. And what I mean by that is Dave Ramaswamy, Jack Maxey, others, Dr. Hatfield, we have been since on this show since January, I think, 25th. But even before then, on the previous show and with my work with the G News guys back in mid-January, people have talked about these models. Yesterday, and the reason in our show yesterday, hours before the press conference, we were able to talk about the University of Washington. We've essentially gone through all of those models, right, in various forms. I would like to know, and I think it would be helpful if it's up there, that, and I understand they're using this for validation to kind of show the media, hey, this is not us. But I think that we ought to have a consensus. This gets back to what we're saying about Cuomo and de Blasio in New York City. They have to get together. I would like to see the CDC model. I would like to see the NIH and the CDC model, the National Security Council, the CIA pick it. I would like to see the model of the United States government, the apparatus that is in charge with the execution of that. I appreciate the fact that we have used, and they have used Dr. Murray's in Washington, who I think has done a tremendous job in doing the wave, and I think that ought to be a checking. But I think the first thing we've got to get to is actually see what the point of view, the angle of attack that's going to come off the model, and that is the consensus among the best minds. I didn't see the CDC. I saw Birx and Fauci, but it's not that they took ownership. It's a sense that we have essentially outsourced this, or we're grabbing these things that are up on the internet, and some are very good. I think some of the slides, where some of the slides come from, Jack?
I don't have the website. I will pull it up before the show, but they literally lifted the slides off of
get the
one
website.
website.
We talked about this. Pull that up now. So my point is on something that's this profound. You know, Jim Acosta talked about that the president himself was in a different place, and we had seen this coming over the weekend from the quarantine, from the impact of New York City and Elmhurst Hospital, in the New York Times article about the apocalyptic day, and his friend. He mentioned that, I think, again yesterday, right, and the impact of that. So number one, it's not just even the optics. When you're sitting up there and telling the American people, and this kind of came a little bit from right field. Now, we had some leaks that said Fauci and Birx gave this to the president, I think, on Sunday afternoon in some briefing, laid it on his desk, and that's when the president says, I guess we got to do this. But it's a big shift. Look, on Friday, correct me if I'm wrong, he signed a letter that said we're going to start opening up the country by an analysis that's going to go county by county, right? We're going to triage these counties. And we had Short on TV last week saying it's only 10 counties. Then they go to on Hannity, they say the quadrant system. That's fine. We disagreed with that. We said, in fact, I went on Jesse Waters. People understand that Jesse Waters' hit was filmed on Friday afternoon, was taped on Friday afternoon, not Saturday. So this was without that information. We've been consistent. If you're going to have shutdown, you got to go hard. You got to extend this. You can't open up the country. So I think number one is it's not that, and I think Dr. Murray was on TV last night. I think he's done a tremendous job. And I think these guys, whether at Harvard or Stanford or the Imperial College or Dr. Long, and they're all directionally kind of the same, and University of Washington did a good job. But I would like to see, and I still think it's quite important for the task force. We have a task force, the task force headed by Vice President Pence. It has all the appropriate senior leadership, particularly on the science side, which the media keeps baying for, right? You got to have the scientists, got to have the scientists. That we have to have, in addition, the model that they've been working off of, right? Not just the University of Washington. You've got a furrowed brow there.
No, I think. Look, they in a previous interview, I believe it was Dr. Birx, said that they put 18 different models in front of the president, or they've discussed and gone through 18 models. I think you're onto something here with the with the different models and the projections. And I think also as a part of that too, I mean, and here's the most, let me go and play the clip from
Hang on for a second before you
Murray.
get off. No, hang on. Get up before you get off this thing. And there was one from Murray last night on Rachel Maddow where he talked about it. I want to see if Greg can pull that when he gets back. But here's the thing. Before we leave this point, we talked about the 18 models, and here's why. It's Real Clear Politics assessment of polls. The polls can have various accuracies in and of themselves, but in the aggregate, when you look at the Real Clear Politics averages, right, and you do this for a living, you know that directionally where those averages come out is a pretty good sense of where things are, correct? And that's aggregating up a bunch of different polls of different quality, right? But the reason Real Clear Politics is so powerful, that's what they essentially did this here. They did the analogous of the Real Clear Politics by showing 18 different ones of varying quality, everything like that, but directionally.
Right, and the directional part's the most important. This is what I was starting to say is that it's what behavioral changes we make and how that changes the outcome. That's the key. Because as Dr. Murray said when he was on TV with Sanjay Gupta, their model has this essentially all these shutdowns being in place through May.
You're getting ahead of me though, but that's
No, but that's what
you're
I'm-
absolutely correct.
so
That's
it's the
important
18 because
and the buried lead of her thing. The most important part of the press conference I thought yesterday, besides the number and up it there, she uses a phrase very particular: full mitigation. This is dependent upon full mitigation. Full mitigation. Okay, my definition of full mitigation is quite different than what's up here in this chart. This is we say for this is what I think we are now to the point that we must pay attention to the details, the signal from the noise. Let's get the noise out of there and focus on the signal. And that's why I want to go back to. I want to see the Real Clear Politics average. Okay, and I assume that is the University of Washington model. Okay, roughly, they have the Real Clear Politics, all this, but the trend line, and that's why they put that up there. It is also important. It's very important, I think, for the administration and the American people to understand that, hey, I see that, but also the task force has the CDC, the NIH, the HHS. You know, it's a $5 trillion government. The CIA, the DNI, the Defense Department. We have the smartest guys in the country on the payroll that have been working this. I want to see their model. I just want to see it.
well, and to that point,
I want to, if it lays right on top of the University of Washington, hey, I'm all good with that. But I want to see that they have, and I think we just got to see that, is that they have something that has casualties of 100,000 to 240,000. And if they have it, how long has that model been around, right? Because we're going to get to what mitigation means. There's buried leads in here that are the thing itself, right? It's her full mitigation, and it's Dr. Murray saying, and you caught it, hey, I didn't even calculate in May. Right? I didn't even calculate in May. I really just looked at the 1 to 30. This doesn't show anything really for plugging in May. Is that making sense?
yeah, no, it makes perfect sense. And this is as part of that, here's what I wanted to see. It's either you go in there saying, if we follow this path, we're going to save this many lives. If we go this path, we save this many. We go this path, we save this many. Then that's your message. We're enacting this hardcore draconian plan to save 1.5 million lives. That is the announcement. But
Joe Norman on this. We're going to go to break and I'm going to get the guys back. I'm not cutting my guys off. The team is right here. I'm not cutting. I'm a little worked up somewhere. But Joe Norman on the second show, because Jack Maxey tracked him down, of the New England Institute of Complex Systems, said this: you must take draconian actions early on in these complex systems to get the results you want. Okay, we're going to take a short break. We're in pandemic. Raheem Kassam, Jason Miller, Jack Maxey, Stephen K. Bannon, episode 91. We're ubiquitous. We want your comments. Hashtag War and Pandemic. Today is a partners conversation. We got a lot of tough stuff to go through. We're going to go through it all. Be back in a second.
War Room Pandemic with Stephen K. Bannon.
The epidemic is a demon, and we cannot let this demon hide.
War Room Pandemic. Here's your host, Stephen K. Bannon.
There are decades in which it appears nothing happens, and there are weeks in which decades happen. Well, ladies and gentlemen, you just went through a March that is one of the most important months in American history, and we're going into an April that will even be more important in American history. And our mandate, our mission here is to separate out the signal from the noise. This is war. The president is a wartime president. Whether you like him or not, he's a wartime president. And what we're here to do is cut through the fog of war. Because remember, the fog of war, it's all information, all this data. You've got to stay focused on the thing itself. Remember what Napoleon told his marshals, the marshals of France, when you set out to take Vienna, take Vienna. It kind of sums it up. Okay, we're going to go back. Let's go back. I want to go back to the press conference, particularly the math. We're going to take a lot of time today, 2 hours. We're going to have Jack Posobiec, who, by the way, people think of him as a troll. He may be all that, but I got to tell you, he knows the CCP and he knows China. He speaks, former naval officer, naval intelligence, speaks Mandarin Chinese, knows the CCP and knows China as well as anybody. And I got a lot of respect for Jack vis-a-vis China. I'm not a own the libs guy, but that's his side project. But he is a very smart young man when it comes to CCP, and we have a massive problem. If you watched Tucker last night, you heard Bill Gertz. Tucker did another drill down on this the CDC, the Chinese CDC lab in Wuhan. There's so much information coming out on that. We're going to be very methodical. We don't get ahead of ourselves. The CCP, we don't want to say it's a bioweapon. We don't want to say people are saying now it was as early as October they knew about, or September or June or whatever. We're going to be very methodical. But we're going to peel the Chinese back like an onion, okay? Because they are devils, and they have the biggest victims of the Chinese Communist Party are the Chinese people, and what they did in Wuhan and what they allowed to happen in Wuhan is not acceptable. It's not acceptable for the human race, and it's particularly not acceptable to the American people. And the freedom of the Chinese people is paramount. Okay, let's go back to we got to get through this pandemic, and now I think people are having serious conversations. Part of that's driven by this situation in New York City, right? Is Wuhan. And I got some blowback from people I know. Said you got to stop calling New York City Wuhan. New York City's Wuhan. New York City's Wuhan without the hard lockdown. We're just doing this because to get through this thing, if you have to go through hell, go through it as fast and as hard as possible. Okay, go through as fast and hard as possible. The biggest problem we have here is incrementalism. It's thinking incrementally. If you think incrementally, you're going to make a bunch of small decisions, and they're going to turn out to be big mistakes, right? When you look in hindsight. Talib's, who wrote Black Swan, he is the head of the New England Institute of Complex Systems. His partner, Joe Norman, came on here. You must, in these situations, you must take draconian measures down front, even if they feel like overreactions, to wring it out of the system, right? To wring it out of the system. And we're exactly at that inflection point today. Okay?
Well, one of the important things about this, and I think Joe pointed this out, you have to take that draconian action before this thing starts moving through the population, because the longer it's there and the more it has gotten into a population, the less that those draconian measures actually work.
Your point, perfect point. That's what the CCP. By the way, let's make a note. Let's get Joe on the show for tomorrow.
Okay.
Definitely, let's get Joe on, and maybe Talib. Let's get them both on if we can. Those are fantastic. They kind of understood what the situation was back in January. What was eventually get us to this place today. Do we have Burke's?
Look,
jump in. You don't have to raise your hand.
I'm raising my hand. But no, I've noticed, by the way, today Steve's throwing them all out. We've had Take Vienna, we've had the Decades, we've got the Go Through Hell.
I'm all jacked up.
you got all the catchphrases out today. Hey, listen. If you do incrementalism, you end up with the President of the United States standing in front of a graph that shows 220,000 potentially dead. All right, that's the problem here. People have to understand this from a decision-making perspective, is that the decisions have to be taken faster and better. I mean, this piece of paper that we have, where's the 30 days to slow the spread thing? This is, by the way, they sent 15 days to slow the spread to households, right? Everybody got this thing on a little A5 piece of paper. It's all over the streets. It's on the floors. It's in people's mailboxes, and they're looking at this thing. Now they're updating with the thing. But here's the thing. Is this grabbing anyone's attention? Does this inspire anything in people?
Let's. I want to get to this, but let's get to this after we get to we're going to get there. But that's why I think we have to be methodical. What we have to do is go through that. We have to disaggregate. That's what we're the only show, and the only way you can look at this is pandemic, economic crisis, financial crisis with the geopolitics. But you have to disaggregate them to understand what the problem is. And we got to focus on pandemic today. And I want to get back to the numbers because she had a buried lead in there that gets to this. The buried lead of Birx, she stands up there and she says, with full mitigation. And it dovetails the thing that you caught that nobody else caught was on Dr. Murray with Anderson the day before, when he talked about May. Do we have her teed up yet?
Yep,
Let's just play Dr. Birx. Because look, Birx and Fauci are clearly the scientists that are setting the context for the decision making.
It's both Dr. Birx and Fauci. Hang with us for this clip here.
If this is full mitigation, why am I standing here saying I want to make it better? Because that's what the model tells you it's going to do. What we do is that every time we get more data, you feed it back in and relook at the model. Is the model really telling you what's actually going on? And again, I know my modeling colleagues are going to not be happy with me, but models are as good as the assumptions you put into them. And as we get more data, then you put it in, and that might change. So even though it says, according to the model, which is a good model that we're dealing with, this is full mitigation. As we get more data, as the weeks go by, that could be modified.
Why does the model now, the top line on the lowball estimate, why does that not top out? I think it said 240,000, not 200,000. Is that a change? Is that because the states haven't been doing enough?
It just has to do with if you had more New Yorks and New Jerseys, Chicago, Detroit, LA, Dallas, Houston, all of our major cities modeled like New York. That's what gets us into trouble.
I got to get Greg. That's not the clip. The clip. That's not the clip. I want to get the clip that she says she talks. Somebody puts a question to her, and she uses the term. These numbers are predicated upon full mitigation. Greg, I need to track that clip down. That's a good clip. Don't get me wrong. This sets it up. But there's another one that's even as powerful. Somebody asked her a question later on about how do you actually get to these numbers? What happens?
And I think
she says something and says, "Oh, this is predicated upon like full mitigation."
Right. And I think there's something society-wise that Americans are a little bit in the mumble tank. Raheem, I'm doing that to get another catchphrase out there. But look, when you're watching a sports game, you go to ESPN and it says this team has a 78% chance of winning.
Yes.
Or everyone assumes that these stats locked in, loaded, and probable. They don't factor in variables. And everyone goes to, like, for example, when the Falcons were up by 1 million points at halftime and they had a 99% chance of beating the Patriots in the Super Bowl. But here's the thing. What I wanted to see in that press conference and to know that only if we do the following can we influence, or if we change our behavior, can we keep the numbers down at this level? Everyone's walking out. Half the headlines today say Trump says 100,000 are going to die. The other half say as many as 240,000 are going to die. There's nothing in the headlines or in the story or anything that media is talking about what we can do to save lives.
This is the most powerful thing, and this comes from #WarRoomPandemic. I caught it from a listener. The most powerful thing that Donald Trump has said since the first day he stepped there, there's not a wartime president. That's the second most powerful. The most powerful thing he said, nothing is inevitable. We understand that we're Americans. Human action and human agency is going to change it. It's going to change this number. We're going to get to that in the show. But first off, you have to understand what people are actually telling you. And I don't think that's sunk into people. What the University of Washington did that was very powerful, and Murray was on, I think it was Rachel Maddow, one of the shows last night, saying about he just did it for the University of Washington. And then he noticed he started looking at California, and he started doing others, and then they just started to aggregate the models up.
Can we tell folks, in case you missed, I want to make sure everyone understands
Yes.
what this University of Washington model is. So Dr. Christopher Murray, he's a professor at University of Washington. They went through and did a study where they did two things that were different from other folks. Number one, they went by deaths, not by infections. So we can see that. They also factored in social distancing aspects that different states had put into place. So they could then go and track it. And what the top line result that came out is that there's a series of rolling peaks over the stretch of this next month. That's what everyone's had. It's not just what you see in New York going on. It's this whole next month is going to be brutal.
And he did it because they were trying to track, University of Washington was trying to track how Inslee and the mayor of Seattle's policies are working. And it shouldn't be lost on anybody that state of Washington, Seattle, looks like they've gotten a little bit ahead of this. Because what they took fairly draconian measures. The businesses, the city, the authorities, the state, they all worked together. Pence flew out there. We had a big federal government. I think that's the first place we'd start doing what are the tests to start doing out there, Jack?
That was the first place they started doing the drive-through testing and the testing outside of the CDC through University of Washington. In fact, very interestingly, What teed off this whole panic was that University of Washington tested a 16-year-old kid, and he was found to have the COVID-19, but he had no contact with anybody. This was the signal that this
was the
was
big story.
loose
Yes.
in the population.
That was
of
community
Washington
transfer.
State.
But
Yeah.
they also did the therapeutics, the Gilead labs test, and they also
Yes.
did the anti-malarial drug, right? They
Gilead
waited both.
Science is based out of San Francisco, and they worked very closely with University of Washington. Actually, the very first person who was treated with Red Hemisphere really was saved at the University of Washington Medical Center.
But Murray was there first to monitor that, and then he started looking at other states, and he's the one that aggregated up the model. Clearly, that had a big impact onto this. But it gets back to human action, human agency. We're still going to go through the numbers. We're going to get to all the action efforts that we think have to be taken. If you're going to take 30 days off, take 30. Let's drop the hammer on this thing. Let's just not lollygag around. Okay, we're in pandemic. The team will be back. We're going to continue our partners' discussion when we return.
War Room Pandemic with Stephen K. Bannon.
The epidemic is a demon, and we cannot let this demon hide.
War Room Pandemic. Here's your host, Stephen K. Bannon.
Welcome back to the War Room. We're live from Capitol Hill today, in a Capitol that is, I think, a little bit. It's a very different Capitol today than it was yesterday, and that's because of this over 2 hour briefing that went on. Let's go back. Let's go to the other clips we got from the briefing. Maybe if you got Dr. Murray, you can play that.
Yeah, this is Dr. Murray on with Anderson Cooper and Sanjay Gupta yesterday, and it's a very important segment. Again, Dr. Murray from the University of Washington, who put together this study.
If your modeling right now is social distancing till the end of May, or stay at home till the end of May, if in fact the president decides at the end of April to end it, the death toll will go up based on your modeling, correct?
The death toll would go up. In fact, we're trying to produce that scenario about what would happen if there was an early of social distancing. And, by the end of April, some states will be down to a pretty low case number. Out here in the West, it seems like social distancing has been working, at least in lowering the trajectory of the cases. And the big question would be, if some, do it, some don't, would you get reintroduction of cases from those where the epidemics are going longer and going to get to a larger peak?
So that's Dr. Chris Murray. And Jack, we were arguing during the break. We love to argue, folks, by the way, during the break. We had a spirited conversation here.
Mommy and Daddy are fighting.
There should be no fighting in the war room.
No fighting in the war room.
No fighting in the war room.
Here is the whole thing yesterday with the chart that was up there. And you had New York, New Jersey, even Connecticut, which was doing a little bit better. But then you had Washington and California. I think it's important to look at California in particular. And look, I've beaten up on Gavin Newsom as much as anybody. I'm from Seattle. I beat up on Governor Inslee all the time. Their actions, it shows that they have had a massive impact in slowing the spread. Washington State was a place where we got the first case. California there. But, Jack, you are arguing on the population density side, saying that it's apples and oranges.
Well, it took me about 30 seconds to prove my point. San Francisco has 17,000 people per square mile, and New York has 27,000. So we are definitely comparing apples and oranges. That implies to me that San Francisco is 1/3 more socially separated without a virus than New York City. So to compare the outcomes of both their plans equally is, to me, a little bit dishonest.
So you don't think social distancing has any impact? Do you think every scientist that's been up there, Dr. Christopher Murray, Fauci, Birx, you think they're all wrong?
I think it has an impact, but to claim that New York's social distancing measures are going to work exactly as San Francisco's, I think is incorrect.
But he didn't say that.
I think what I am saying, okay, I won't put words in anyone else's mouth. If everyone's listening, there are 17,000 people living in a square mile in San Francisco. They are socially separating perfectly, right? There are 27,000 people living in a square mile in New York City. They are social distancing. Do the math. Put 27,000 people in a square mile and 17,000 in a square mile and have them stand apart as much as they can. The people in San Francisco are able to stand 50% further away than the people in New York, all things being equal. So I think that one of the reasons you're going to have a problem in New York is one of the reasons we had a problem in Hong Kong with the SARS-1 When you put people in a dense apartment building and they're all touching buttons and they're going up and down and they're all on top of each other, that is a much different vector situation than people living in a neighborhood around
Well,
Seattle.
then how do you explain a New Rochelle, which is not New York City, and the way that they blew up?
I'll explain New Rochelle perfectly. New Rochelle, a man was infected. They were in a synagogue. It is a very tight community. They have social practices of greeting and hugging and things like that that are not necessarily the same in other places. And almost their entire synagogue was infected. So
you just made my point. You just made my point, Jack, and thank you, by the way, that social distancing actually does work, because if you're going up and hugging on people and kissing them, you're going to go and spread it. Here's the whole point. The whole point of these charts, Jack, and you're just plain wrong, is that the goal here is to try to keep as many people safe as possible. And if you just say, these, look at New York, they're more densely, so we shouldn't be doing these things, then people are going to die.
The key to what Newsom, San Francisco, and Inslee did is they started early. They effectuated these. They put these policies into place. They stuck with them, and they brought every tool available in the tool shed. Right. That's the thing. Is it's a coordinated approach that you do, but you got to do it early on and get on with it.
Listen, I appreciate it, and I defend the administration. I've said that there's this nonsense of giving people a spread from 100.2 million is ridiculous. I understand the idea of social mitigation. I get this, but let's look at it historically. Let's look what even Debbie Birx is showing. She's showing us, well, here we are at the bottom. It's going to be sometime in late June. Okay, this is too much of a spread for people, right? Either give them the facts, it's going to suck all the way to July 1st, or stop trying to be like, it's 15 days, it's 30 days, it's 60 days. That, to me, is not leadership. And what I would like to see the president do, if I'm the president, I'm going to go out there and be the leader. I'm going to let these guys, the scientists, the ones who are making the decisions for America, the ones who work for the National Institute of Health, the Center for Disease Control, these guys are in charge of our health. All he is doing is taking instruction from them. I would lay everything on them and be the leader that the people want, right? These are the staff officers creating the battle plan. Donald Trump is Patton leading the army to
okay, what does that mean in real life?
What that means is the president has to be an inspiring leader, and he should stop trying to pretend that he is the interpreter of scientific information for the United States. All that will do is trip him up over time.
But you have to make your policy decisions. The decisions you make have to be based upon the set of analytics.
I agree, and he has said that. But I would have the scientists explain why the decision was made rather than have Donald Trump explain why the decision is made, because he has a vernacular that kind of stumbles through the data, and it makes it, I think, even more confusing for people. I would simply have Fauci and Birx stand up there, state their plan,
Let's go
and
back.
own it.
I want to go back to tomorrow. I don't know if we have any more clips. Were you confused coming out of yesterday?
Was I confused coming out of yesterday?
Watching the presentation, were you confused by the presentation, the analytics, and what the president said?
Personally, I thought it was a giant CYA, probably on the part of the people advising the president and the NIH and the CDC. We looked at these numbers all the way back in January, and 2.2 million was off the charts. What we came up with the analysis with the several different models.
That was herd immunity. That's why I said let it go and just have a herd immunity.
I understand, but we're going to have big, data sets that are going to be coming in the next week that potentially could change this whole thing. The Germans are doing 100,000 person test on the antibodies. We are apparently going to launch the antibody test. I mean, talk about how the testing is. I spent an hour on the phone last night with a guy who runs a testing company in Puerto Rico. They already have the test. They're doing 100 tests a day. Their biggest problem is the PPEs and trying to isolate each person getting a test.
They're doing 100 tests a day.
100 tests a day.
But that's not a lot of tests.
This is just one organization.
Okay,
though.
fine. He's not the head
Other
guy.
hospitals
Right,
and things are doing it.
Perfect.
And he said that they're going to get the antibody tests by next week, and they plan on doing the antibody tests as widely as they can.
They're getting the antibodies next week. Okay, so let's go to you've had 3 kind of action plans coming out of 4. You've had the Pence team. Which, if you put to me, and just say as a constructive observation, if you tell the American people 100,000 to 240,000 dead civilians, if we have full mitigation, this is just not full mitigation. This basically says we still have the patchwork of let your states and local guys follow their instructions, and then there's a bunch of stuff if you're sick. This is equivalent, I think, of happy talk. I just don't think this is not. This is some overall maybe guidance, but this is not going to do anything to spread. Not when you talk about these numbers. When you talk about you've just laid out 100,000, 240,000 dead. And your Fauci and Birx have continued to use the term full mitigation.
Right. And where the road here, the difference is Dr. Scott Gottlieb, the former FDA commissioner, was saying on CNBC this morning is what folks are doing is state-by-state basis. We had a good spirited conversation about New York and New Jersey versus California and Washington. Yeah. But the real thing here, and I think we could all agree to, this was a big, massive wake-up call for Florida. Not to get lost, but Florida. If I can say it again. In fact, can I play the clip of Dr. Gottlieb?
Gottlieb's powerful.
I know we've had a lot of these numbers kind of floating around out there, but it took on a new significance yesterday. When you hear the president talk about it, you hear Dr. Fauci talk about those numbers and think 240,000, even if we maintain social distancing. What has to happen? Can we bend the curve effectively, even if that number is the model, if we're doing everything we're supposed to be doing by staying at home?
Well, I still think we can. Those things are hard to model. It's hard to fully bake in the impact of the mitigation tactics that we're employing right now, the social distancing. And we're seeing it have some effect. I mean, San Francisco looks like they're coming down their curve. Seattle really hasn't come up their curve, even though they had a large cluster and did a lot of things wrong early. It seems to have had an impact, the mitigation techniques that they've adopted there. And New York may peak next week. New York does seem to suggest signs of slowing infection. So these approaches do work. And you look at cities like Chicago and Boston and Philadelphia and Detroit, which are going to have large outbreaks. They implemented some of these measures earlier than other cities, and hopefully it's going to have an impact and be reflected in the numbers over the course of the next 2 weeks. I think the real wild card here and the decision point on whether or not we're going to have the bad outcome that Dr. Fauci and Dr. Birx talked about is what populous states like Texas and Florida do that really haven't taken aggressive steps. Even now, they're large states. They have large urban areas that have very dense populations. And if they don't get more aggressive, then we could be on the cusp of some of those bad outcomes. I think.
So that's the Dr. Gottlieb from this morning.
And he's the FDA guy. He was Trump's first FDA guy. He's a Trump guy.
He's a really smart guy. And he was just a really smart guy, good voice of reason here. But the point that he's saying is the number of these states around the country, we're going to look like that 240,000 number unless some of these states get it together.
So Lindsey Graham, I think last night, one-handed, he tweeted out, and we've retweeted this, Bill Gates has now been out and put out a program and on CNN last week and then over the last 24 hours. And then we at the Worm, Raheem, you want to talk about what we're launching today? We're going to wait for that, or this is very important. You've tweeted out, we're going to add to this, but talk about what this program is.
Yeah, the 30 Days to Save America, very much the baby of Jason Miller's excellent communications brain. You can go now to the domain, which is we've just got up, 30daystosaveamerica.com, 30 the number, 30daystosaveamerica.com. On the site there, we're going to have full explanations of the plan and the program as we've put it out there already, as Jason tweeted this morning, and also ways for you guys to get involved. So there are graphics for every single different social media site you can imagine. You've got your Facebook bio pictures, posts, there's going to be GIFs, there's going to be A4 posters, lots of different designs. I want to thank the design team for getting into that over the last couple of days. It's 30daystosaveamerica.com.
And I do have that clip, the long-awaited Dr. Birx clip.
Okay, good.
Thank you, Greg.
Let's play it. Great.
Simultaneously, there was a modeler out of the University of Washington that modeled from cases up, utilizing the experience around the globe to really understand how this information that we have from Italy and Spain and South Korea and China could really help us give insight into the hospital needs, the ventilator needs, and really the number of people who potentially could succumb to this illness. It is this model that we are looking at now that provides us the most detail, of course, that is possible. But this model assumes full mitigation.
That, ladies and gentlemen, is the most important thing that came out of that press conference yesterday. She walks through everything we've talked about, from South Korea to Italy to China, the good, the bad, and what didn't work, okay, about the modeler. And then she says, the assumption here is under full mitigation. Okay, we're going to take a short commercial break. We're going to return. Go to hashtag War Room Pandemic for your comments. The War Room team is going to be back. We're going to continue to grind through this. A real War Room session here today. Be back in a moment.
Illustration: out of the top 10 most dense cities in America.
War Room Pandemic with Stephen K. Bannon.
The epidemic is a demon, and we cannot let this demon hide.
War Room Pandemic. Here's your host, Stephen K. Bannon.
The day after the state steps up and gives one of the most, I think, somber, important briefings that's ever been given at the White House. I mean, this is equivalent to right after 9/11, Cuban Missile Crisis. I mean, this is the top 5, maybe the top 1, because I don't believe we've ever talked about potentially a quarter of a million civilian casualties. Although in the Cuban Missile Crisis, they're applying much more with a nuclear strike that could have come from Cuba. War Room Pandemic, we're ubiquitous. We're everywhere, Facebook, YouTube, Dish Channel 219, Newsmax later in the day, the John Fredericks Radio Network, on radio networks up in Chicago. You can hear us. We're throughout the world on Mandarin language, subtitled. Raheem Sam, you jumping in there?
Yeah, I like the Pluto app. I just like it.
Good.
It's free. It's got a great I've been using it for months to watch like CNN and stuff like that.
What is Pluto?
I don't know. It's just it's some web streaming TV app thing. I have no connection to it. I just really like it, and I noticed we're on there, and it's just a great way to watch the show.
All of America's voice.news. Yeah, the movement, the Trump movement site guys do a fantastic job. I want to thank John Fredericks down in Richmond and the folks out in Colorado to help us co-produce the show. I know it's not as easy as it seems. It seems so easy in the morning, but it's actually quite complicated. Let's go back. We have Lindsey Graham, Bill Gates, the War Room crowd, all essentially saying and looking at this and saying, look, if you're putting up there's 100 to 240,000, if your top advisors are using the code word full mitigation, if you're going to shut the country down for 30 days, what you don't want, we're burning daylight. We already spent 15 days. You got a hodgepodge of stuff going around the country. I think it's 75% of the country is essentially some sort of lockdown.
80%.
80%, so 20% is not. You've got we're down for 30 days. What we don't want to be down is for 60 or 90 days. That's when you're going to have problems. Number one, it's just not America's way to do that. Number two, you heard Larry Lindsey yesterday. We're going to start to have the logistics systems going to start to have problems. Also, financially, we just can't be coming up and saying, "Hey, we're going to do another $2 trillion bridge, or we're going to put another $6 trillion bazooka into the Federal Reserve, into the economic crisis and financial crisis." Those are all dollars eventually, and I understand interest rates are at historic lows. That's going to go. Somebody's going to eventually have to pay that back, and it doesn't mean interest rates are going to be zero forever. So the key point is we got to get through this thing. If you're going to go through hell, go through as fast and hard as possible. Now, Lindsey Graham tweeted out last night his observations. What were those? And he's a huge ally to the president, although they go back and forth on DACA and the wall and those kind of things. But he's a huge ally of the president.
So South Carolina Senator Lindsey Graham tweeted out, "Must be all in when it comes to saving lives." His next tweet, for the next 30 days, we should be all in on containment and mitigation. Could save tens of thousands of lives. Number one, time to consider a national shelter in place. Number two, time to consider limiting or banning domestic and international air travel for the next 30 days. He then continues in a third tweet. Just saw that tomorrow there are still direct flights from Detroit to New York, New Orleans to New York, New Orleans to Detroit. Does this make sense in terms of aggressive containment?
I think we pulled. Maybe we get to it next hour. The airline analysts are on. I think it's air traffic's gone from 1.5 million a day or something like that, around 2 million a day, to 150,000. These flights are leaving. They're basically empty. Bill Gates has got a whole program: shelter in place, do massive testing, antibodies. The War Room is kind of our point is you do this in twofold. Number one, lock it down. And you should stop all international travel into the United States by air immediately. Okay? I noticed today in doing the check, Raheem, that there's flights from Switzerland coming in. We haven't banned flights from Europe.
Right.
We've banned flights from the Schengen, from the EU.
Yeah, the Schengen, the open borders.
The Schengen, open borders areas. Switzerland, which you can still get there and take a flight out of Zurich. I think there's one flight a day now coming in from Zurich. I'm not picking on the Swiss, but Switzerland's got a problem. We don't need any additional potential virus coming in from out the world. We got enough ourselves. We're now the new China in this. We're the new Europe. We're the ones, the biggest one. We've got to stop anything coming here. If any business or activity or social gathering, anything like that for the next 30 days, the country shut down. Basically, we just got to shut down all. And I think you have to shut down domestic air traffic. It's almost shut down anyway. We're bailing the guys out. So you got to throw another $2 billion on it, whatever it is, for the month. It has to happen. You don't want mobility. I'm for the shutdown of all vehicular traffic. This is what the Chinese did, interstate, except for the truckers and people with essential goods. If you got to see grandma, the April's not the month you're going to go see her, right? You shouldn't be getting near her anyway because you could be spreading the disease to her. Maybe that's so. If you're going to shelter in place, and it should be a national. We're a nation. Let's get this organized and this is, I think, at the top level, Vice President Pence. This has got to be a much tougher. This is just not tough enough. Not if you're putting up. It might have been fine when you did this originally, but now I've got the President of the United States up there for 100,000, 240,000 casualties. A financial debacle, let's face it, coming off of this, maybe a depression as far as employment. Everybody worried about this. And you're taking matters to bridge that. We understand you're taking matters to bridge that. So people should feel confident there's going to be cash there. But for the next 30 days, you've got to get on with it, right? We had some other things, mass testing, use the antibodies,
hydroxychloroquine.
Get that approved. They're doing the 10,000 thing in New York, but people up there, particularly in the emergency rooms, the doctors are always using it as a prophylactic, right, themselves.
We don't know that for sure, but I think that they should be doing it.
I know that for some guys that have talked to me. Because they want to try to live through this, right?
Yeah, and they should. I mean, one of the things that we can look at here and really give the president some props. Fauci obviously doesn't want us to end the flights, right? Let's remember, Fauci didn't want us to end the flights to China either. And now Fauci sits up there and goes, that was one of the best things that the president did. And so what I think we have to understand with this president is that he is a leader, and he has been fighting since the day he got in office, this administrative state. And it took the president on a weekend to obviously grab somebody at the FDA by the collar so that they could make hydroxychloroquine, azithromycin, a treatment that they could use on sick Americans. Mm-hmm. The FDA, left to their own devices, would have been doing studies till this curve was gone. So that is leadership. That's the kind of leadership I want out of him. Let the others play with the science.
So give us those 2 points again, Jack, because I want to make sure that people are getting these in addition to what Lindsay said.
Well, I think the point that the president went to the FDA, and this was a personal move on his part, to get them to open up hydroxychloroquine and azithromycin for treatment of sick patients.
As a therapeutic. Okay, we're going to take a short commercial break. We got the next hour. We're going to continue to grind through this. The details of 30 Days to Save America. Also, Gates, Lindsey Graham. We're going to be back in the War Room in just a minute.